This video is about multipass ozone major auto hemotherapy. We have already discussed a lot about the indications of auto hemotherapy. This patient had almost all his veins collapsed, and so it was decided to use a neck vein for major auto hemotherapy. Both MAHT and EBU can also be done through a central line in patients in whom veins are not otherwise visible. The vein is identified and an 18 gauge Venflon cannula is inserted into the vein. So, the vein is located after local anesthesia is given and the cannula is inserted, and once the blood flows into the cannula, the plastic part is pushed in and the patient is ready for the hematogenous procedure. So, the vein has been approached and then it is fixed in place with a tape, and the tip is plugged with a heparin syringe after it is anchored in place. We do not want the blood to get clotted, and because it was a very difficult vein, it is essential to anchor it well. 5,000 international units of heparin is sucked into an MAHT bottle, meaning the heparin is first drawn in a syringe and it is pushed into a bottle and allowed to suck in. Again, another 5,000 international units of heparin is diluted with 5 ml of distilled water, which is used for priming the transfusion set. The transfusion set and the bottle have to be primed to ensure that during the procedure there is no clotting of the blood. In an average MAHT procedure, around 8 to 10,000 units of heparin are used. Here, the larger volume, because of dilution, will ensure that the entire interior of the drip set is primed till the tip of the lure lock, which is going to be attached to the patient. So, we can see the blood flowing in comfortably. There you go, and we wait till the dilute heparin reaches to the bulb of the special ozone compatible blood transfusion set, which is used with the EBU system, the MAHT system. The lower end of the primed set is now attached to the Venflon site at the neck, and the tip of the bulb is pushed into the MAHT bottle after the blood set is passed through the bottom of an ultraviolet irradiation chamber. We now open the system and allow the blood to travel up to the bottle. The blood flow is started and the blood connects in the vacutainer because of the vacuum suction effect of the bottle. We can see that the blood is flowing into the bottle and collecting into the bottle. In this patient, as we want to give a high dose of ozone, we are collecting about 60 ml of blood in the bottle. You can see the blood stream. The nurse's glove was hiding it. In the meanwhile, 50 cc of 100 gamma ozone is also drawn in an ozone compatible syringe. In this case, I am getting ozone at 120 gamma and I am taking about 60 ml in an ozone syringe. The machine you see is an IAOS Mark 7 ozone machine. The blood volume collected in the bottle is close to 60 ml. Once the blood is collected in the bottle, the flow is stopped. In the meanwhile, the syringe, 50 cc syringe, would have been filled with ozone. A 16G needle is attached to the syringe and the tip is bent to the right angles. The blood flow is stopped and the syringe extracted from the machine, the knob switched off, the regulator turned off. A 16G needle is attached to the tip of the syringe, the needle is bent and the tip is now inserted into the center of the plus symbol on the top of the bottle. The vacuum inside the bottle ensures that the ozone is sucked in, blood bubbles and becomes cherry red. The bottle is inverted and placed into the stand. So here we can see that the syringe is inserted, the ozone gets in, and once the syringe is removed, this acts as an air vent. The blood flow is opened. The ultraviolet lights are switched on and the blood is allowed to flow into the patient. Once the bottle has less than 5 ml of ozonized blood, the transfusion set is clamped, the bottle is taken out, half ml of 2000 or 2500 international units of heparin is now injected into the bottle again for the second pass. So here's how the bottle is taken out of the UVBI stand, still attached to its transfusion set, and I am holding a heparin syringe in my hand which I am putting into the bottle and it gets pushed in because there is no suction in the bottle left. Now we have to create suction in the bottle and then open the blood set to allow the bottle to fill with the second pass. A bent 16G needle is connected to a silicone tube which is attached to the vacuum port of the ozone machine. So here is a silicone tube and one end is attached to the ozone machine vacuum port and the bent needle is pushed into the bottle to create vacuum. Once vacuum is produced, the blood set is opened and another 60 ml of blood is allowed to be collected in the bottle. This time we can actually increase even up to 100 ml. So this is connection of the silicone tube into the vacuum port and that is a bent needle which is entering the top of the bottle, producing vacuum, and the blood set is opened. Now the blood stream starts coming rapidly and we can see the blood flowing and filling up the bottle. So the vacuum is created from the top and blood is flowing fully till we get 60 to 70 ml. At this stage, we can even get more blood into the bottle. The vacuum is really high, so I have removed the bent needle and the blood is coming. This time we are extracting 100 to 120 ml of gamma, 120 ml of oxygen at 120 gamma, making it 15,000 microgram per ml, and this is going to be used to ozonize the blood, so that a total of 25,000 to 30,000 microgram per ml have been infused into the patient's body. You can see that close to 60 to 70 ml of blood has been collected. The first syringe is now filled up with 120 microgram per ml of ozone. Once this syringe fills up, we connect it to a bivalve. As such high concentrations of ozone can only be produced at 1/32 of a liter flow. The ozone filling in the syringe is slow. Here about 110 or 120 ml of blood have been connected. Now we are collecting 2 syringes with 60 ml each of ozone, and the 2 syringes will be connected to each other at right angles through the tip of the third point of the bivalve. A 16 gauge needle will be connected, and this needle will be again bent at right angles, and through this needle both the syringes of ozone will be pushed into the blood. In this way, in about 100 to 120 ml of blood, another 120 ml of 120 microgram per ml or 125 microgram per ml, making it close to 15 milligrams of ozone, is mixed with the blood. So the needle is bent at 90 degrees. It is put through the plus mark of the bottle. Sometimes with the ultraviolet glasses on, it is difficult to get the correct point spot on, and in such case it is better to remove the spectacles, because we need to ensure that the needle is right into the stainless steel diffuser to allow the ozone to be sucked in or pushed in. So now we are at the right spot, and that is there. You can see one ozone is already gone in, and we turn the knob, we push the second, the blood is bubbling and gushing with ozone. Instant it is done, the bottle is overturned. We close the bivalve to stop backflow of blood, and once the bottle is upside down, the blood flow is started and the bivalve is removed. This needle acts as an air vent for blood flow. Only after the bottle is reversed, the bivalve is removed or the syringe is disconnected, because the pressure inside the bottle makes it hyperbaric. The stainless steel diffuser is inside the blood, and if the bivalve is removed before the bottle is being inverted, blood will gush out. So one has to be very careful about it. Now we have removed the bivalve, and we are ensuring that no blood gushes out. These passes can be repeated as many times as needed, going up to 10 to 12 or even 20 passes. depending on the patient situation and the amount of ozone that has to be administered. At the right time, the bivalve is opened again to act as a air vent. The blood is flowing freely, patient is comfortable. Each pass administers 10 to 15,000 gamma or microgram per milliliters of ozone. The next short 5-minute clip will show you how we give the same thing in a single pass. Once the last pass is complete, the set is removed from the bottle and the blood is allowed to drain into the patient. The venipuncture site or phlebotomy site has to be packed tightly or wadded tightly and pasted with adhesive plaster. Because of heparinization, we do not want any bleeding post procedure. Adhesive plasters around this area of neck are a little difficult to remove, and so it is better to use a hand sanitizer to pull them off. Now we are showing you a single pass 14,500 micrograms or 15,000 gamma administration to another patient. Here the blood drawn is 120 ml. So the bottle is capable of sucking up to 150 ml of blood, and at this stage we will only have to push the ozone. So here we have taken 120 ml of blood. Once the blood is sucked in, the blood flow tube part is closed using 2 syringes. We collect 60 plus 60 ml of 125 gamma or 125 microgram per ml of ozone in each of the syringes. The 2 syringes are attached with a bivalve. A needle is attached to the tip, bent at right angles. The same is inserted through the plus of the bottle. One will be sucked in because of the remaining vacuum, whereas the other might have to be pushed in, and we have to immediately close the bivalve to prevent the outflow of the blood. So we have to make sure that the needle goes right into the diffuser tube. You can see the one part of ozone has sucked in immediately on its own. The second part has to be pushed, and then we close the bivalve fully. The syringes can be extracted and the blood flow started. The bottle is reversed, and once the blood flow is continuous and there are no air bubbles, we can remove the bivalve, and the high pressure inside will only cause a faster flow of the ozonated blood. The ultraviolet lights are switched on. The bottle is put into the hanger and the hanger level raised so that highly ozonated ultraviolet radiated blood is flowing into the patient. I hope the steps have been clearly explained and you have understood the procedure and process. To learn more about these techniques or to do the advanced online ozone course, please send a message in WhatsApp to me and I shall send you the details. Please do not make calls and send me just WhatsApp messages. Have a nice and pleasant day. Thank you.